aim of sparking meaningful dialogue and drive actionable solutions for a more inclusive and smarter healthcare ecosystem, Optum, in association with CNBC-TV18, hosted HealthX Conversations and reach out to some of the leading educational institutions of India. The inaugural session was conducted at IIT Delhi, where Prashant Tandon, CEO of Tata 1mg and a pioneer in leveraging technology for accessible healthcare, engaged with the students in an effort to inspire the next generation of young professionals to explore and contribute to the rapidly evolving healthcare sector.
So as you gather at its core, HealthX Conversations through engaging sessions, expert insights and campus dialogues aims to shine a spotlight on transformative ideas and approaches to transform the healthcare industry, so to say, and the services that are being delivered at the highest standard efficiency while being accessible and affordable to all.
Thank you. It's a pleasure and honor, and I'm absolutely delighted to be back on my own campus. As I was an alumnus, graduated in 2002, and have very, very fond memories of IIT, and anything associated with IIT is very close to heart. So thank you for inviting me to my campus and giving me the opportunity to talk about something that I think is this is an excellent initiative, just talking about this industry which is on a cusp of massive change and historically has been not on the radar of technology and management professionals. It's been one of those sectors that has grown or evolved in a very different kind of a dimension from the rest of the organized systems out there, and that makes it even more interesting. As 2009, me and Samir, who's also IIT Delhi, we were both in the Bay Area just brainstorming, and we thought, okay, one area that definitely makes a lot of sense and has to transform over the next few decades is going to be healthcare. Having seen it in the US, and certainly technology is going to play a major role in that. This Indian healthcare system will get created in a way or organized in a way that will be different from the West. And not having legacy systems and technology is probably going to be the driver. And that's going to give an opportunity for a small entrepreneur to start and build out something. And maybe that's where we put our energy. And we came back to India with the thought process that healthcare technology is going to change how healthcare works in India.
Hello, sir. Thank you for visiting the campus. Very delighted to have you here. My name is Pranali, and I come from a healthcare background. And during my internship, I used to have these stints in rural areas. And the problem and the situations, as we all know, are very dreadful. So even though things like remote patient monitoring, care plan oversights, and electronic healthcare systems are existing and are gaining a lot of traction, but the problem which has existed till now is awareness. People are not aware of all these technologies. And when I talk about awareness, it is also the problem in urban areas wherein people have a lot of less knowledge about insurance penetration or disease prevention. So what can be done, and what can tech-driven healthcare organizations like Tata 1mg and Optum implement to solve these problems?
Sure. So see, awareness certainly in healthcare has been historically low. And as I said, one of the big reasons why is it lower than a lot of other sectors is because not too many people are creating content with the consumer at the center. The system was designed with that if you have a problem, you come to the doors of healthcare. And especially when you go further far-flung, there will be a broker or an agent who will then decide which healthcare door you need to go into. And this entire awareness of what are your options, what can you look at, has never been explained to the consumers. Nobody invests much information and awareness in healthcare historically.
So it was a very insightful session, changed my perspective a lot about the healthcare industry.
The session was really interesting and very insightful for me. I'm someone who is not from the healthcare industry, and this has given me a different insights altogether to the session.